Hello and welcome to MediByte. Today, we are diving into a really specific health topic, cervical fibroids. Our entire goal here is to make this subject clear, simple, and just easy to wrap your head around.
We're all about cutting through that confusing medical jargon to give you information that's straightforward and trustworthy. So if you've ever heard the term cervical fibroids and wondered what that really means, you have definitely come to the right place.
So here's our game plan for today. We've broken this down into 5 key parts. We'll kick things off with a general overview of fibroids. Then, we'll zoom in on cervical fibroids specifically. After that, we'll talk about symptoms, how doctors figure out what's going on, and finally, what treatment options are on the table. Let's jump right in.
All right, first things first, let's start with the big picture and get a handle on what fibroids are in general.
So fibroids, or leiomyomas if you want the official medical term, are basically growths made up of muscle and fibrous tissue. Now here is the absolute most important thing to know right from the start. They are almost always benign. That means non-cancerous. In fact, they are the most common type of non-cancerous tumor in the female reproductive system. So that word tumor might sound scary, but in this context, it's way less intimidating.
Okay, so now that we've got the general idea down, let's narrow our focus. What exactly makes a fibroid a cervical fibroid? Well, it all comes down to one thing: location, location, location.
To really get what cervical fibroids are, we have to talk about the cervix itself. Just think of it as the gateway to the uterus. It's that lower, more narrow part that connects the main body of the uterus down to the vagina.
And that right there is the key difference. See, most fibroids grow up in the main body of the uterus. Those are super common. Cervical fibroids, on the other hand, are way less common, and that's because they grow specifically in that lower gateway we just talked about, the cervix.
All right, let's move on to the part that many of you are probably most curious about: the symptoms. How would you even know if you had one?
This is the million-dollar question, isn't it? It's really important to know that a lot of fibroids, including cervical ones, can be completely asymptomatic. That's just a fancy way of saying they cause 0 symptoms at all. But when they do make their presence known, there are some pretty specific signs to watch out for.
The symptoms are often tied directly to the fibroid size and exactly where it's sitting. The most common sign by far is unusual bleeding. Maybe your periods get way heavier or you start spotting between them. Pandering intercourse can also be a red flag. And if a fibroid gets large enough, it can start to press on your bladder, which can lead to urinary troubles or just a constant feeling of pressure in your pelvic area.
And this is exactly why paying attention to a symptom like heavy bleeding is so crucial. It's not just an inconvenience. Over time, losing that much blood can lead to anemia, which means your red blood cell count drops. And that can leave you feeling just wiped out, tired and weak all the time.
So, let's say you're experiencing some of these symptoms. What happens next? Let's walk through how doctors actually investigate and diagnose the problem. It's a pretty logical process.
The whole journey usually kicks off with a simple pelvic exam. A doctor might actually be able to feel or sometimes even see a fibroid during the exam. From there, imaging tests like an ultrasound are used to get a much clearer picture. And of course, it's absolutely critical to rule out any other conditions that could be causing your symptoms.
Doctors have a few really good tools to get a precise diagnosis. A transvaginal ultrasound or an MRI can give them a crystal clear image of the fibroid. They'll likely do a blood test to check for anemia, especially if you've had heavy bleeding. And, so importantly, a Pap and HPV test helps them rule out cervical cancer, which confirms that the growth is, in fact, a benign fibroid.
Okay, so we've covered what they are, the symptoms, and how they're diagnosed. Now for the final and maybe most important piece of the puzzle: treatment. So what are the options? The path forward with treatment really hinges on one single thing: symptoms. The big question is this fibroid causing you problems, or is it just there? The answer to that question determines the entire approach.
And here's some reassuring news. For small fibroids that aren't causing any trouble at all, the best approach is often no immediate treatment. Instead, doctors usually recommend something called watchful waiting. It's exactly what it sounds like. They just monitor the fibroid with regular checkups, but they don't actively intervene. But if the fibroids are causing disruptive symptoms like severe bleeding or pain, then surgery becomes the main option. One procedure is called a myomectomy. This is where a surgeon goes in and removes just the fibroid, preserving the uterus. For very large fibroids, or in cases where other treatments haven't done the trick, a hysterectomy, which is the removal of the entire uterus, might be recommended.
And that really covers the fundamentals of cervical fibroids. So we want to leave you with this question to think about. If any of the symptoms we've discussed today sound familiar, the most important thing you can do is have a conversation with your healthcare provider.
We really hope this breakdown was helpful for you. If you found this explainer valuable, please do us a favor and give it a like, share it with anyone you think might benefit, and be sure to subscribe to MediByte for more clear and trusted health information. Thanks so much for watching.